Sometime in the spring of 2011, I recall having a doctor's appointment and telling my doctor of a rash on my upper thigh. She told me it looked like an infected spider bite. It was not a typical bullseye rash. It was a small, raised, red oval rash. I thought nothing of it. At the end of October, 6 months after the rash, I felt extremely ill. Within a matter of weeks, I was experiencing severe joint, muscle, and bone pain, tremors and cognitive issues, numbing and tingling throughout my body, partial paralysis, vision problems, burning sensations that would migrate from one part of my body to the other, difficulty walking, thinking, and unrelenting fatigue. I was admitted to hospital. My case was extreme. I honestly thought I was dying. As I lay in hospital for several weeks, my doctor working diligently trying to figure out what was wrong with me. At no point was Lyme in question. All tests came back normal. My sister drove me from my small town up north in Sturgeon Falls to Kingston in hopes of a diagnosis. The first doctor I seen at Emerge at KGH suspected Lyme disease. He gave me 14 days of doxy. Within 5 days of taking the antibiotics, most of my symptoms had diminished. He tested me for Lyme, which came back negative. I believe antibiotics saved my life. I was ultimately tested through IGNX in the States. The tests came back Centers for Disease Control positive, with almost every single band positive. I was reinfected with a more virulent strain. I've seen many Canadian infectious disease doctors that denied me treatment. One, in fact, would not even see me as my Canadian test was negative. I was forced to seek out an LLMD in the States and pay out of pocket for medical treatment. After 4 months of oral antibiotics, I was doing quite well. About a month after stopping the antibiotics, I relapsed. I continued for 2 years on and off IV and oral antibiotics, relapsing every time I stopped treatment. I begged Canadian doctors to help, as I could no longer afford out-of-pocket treatment. I was denied care. It's been over 2 years since I've received antibiotics, and my health has deteriorated to the point of mostly bedridden. I am here today, but I am heavily medicated with strong pain medication. My son has tested CDC positive as well. He has been denied treatment in Canada. He has congenital Lyme disease. He has been treated by Dr. Jones in Connecticut for a year. He is currently doing well. Again, I pay out of pocket for medical costs. Lyme should be a clinical diagnosis. It can present in many different forms. Most people do not get a rash. We need accurate information given to the public. We need doctors to be educated on early diagnosis and early treatment. We need doctors to learn about disseminated Lyme. It is estimated by the year 2016, 80% of Canadian population will be at risk for Lyme disease. 41% of ticks tested in Kingston are positive for the bacteria. Signs should be put up in known endemic areas. We need accurate testing to show the true numbers of the disease. Had I been diagnosed and treated early and properly, I would not be in the position I am in now. My family, especially my children, have suffered tremendously as they watch their mother's health decline. Lastly, we need to find a cure for late-stage Lyme